If your hip hurts most when you're getting up from that seated position at first, but then it seems to ease off as you get going a little bit, you're not imagining it. This is one of the most common symptoms that my patients report who have hip osteoarthritis. So what we're going to do in this video is explain why this pain might be present, go through some of the movements that I use to help patients become more comfortable and more confident in their hip, and then help you understand how you can look after this more in the long term. I'm Rick Porter, physiotherapist who focuses on understanding why your body behaves the way that it does. If that's something that you're interested in, then please consider subscribing. Considering what is actually happening. So a lot of my patients who have hip osteoarthritis believe that when they get more pain, that means that there must be more damage, but it's often not the case. If we think about the hip being in a bent position for a prolonged period of time, there are a couple of things happening. One is the hip joint itself is not getting a lot of circulation. So through movement, it brings circulation and nutrition into the joint. So by keeping it still, we don't get those things. The second thing is that we are keeping muscles in one position. So some muscles are longer at the back and some muscles are shorter at the front. But what this does is it doesn't prime them for activity. In fact, it more often than not makes them think that they don't have any work to do and they're more inclined to become more relaxed, less awake. So when we are moving from this position to this position, we haven't done anything to prepare that joint or those muscles for that change in position and load. My goal isn't to chase pain, it's to help the hip feel more prepared for movement. So what that means is restoring some range of motion, preparing the muscles for the load that is about to take place, and involving the rest of the body in supporting that hip in the job that it's about to do. Okay, movement number one is the lateral pelvic tilt. And what I'm going to show you here is that the pelvis is part of the hip joint. So it's the socket in which the ball inserts. So as I'm sitting here, you can see as I move the pelvis side to side, I'm actually moving the socket of the hip joint. The pelvis is leading the movement sideways, but the hip is getting some movement nutrition and some movement preparation. Let me show you what that looks like in practice. So I take one side of the pelvis down, one side of the pelvis up. I move smoothly across the bottom of the pelvis. So I'm moving through one side of the buttock to the other, so that the other side of the pelvis comes up and the opposite side goes down. So I had a patient who called this the pelvic seesaw. There's a bit like one goes up, one goes down, one goes up, one goes down. And here we are mobilizing the socket of the hip. 12 repetitions, 3 sets. Move number two is the knee creeper. Credit to Joanne Elphinston. This is pelvic rotation. So as one side moves forward, the other side moves back. My bottom stays securely against the chair. Watch out for trying to hike up with a lateral tilt when all we want is forwards and backwards. Only go as far as what is easy to start with, and then gradually increase the movement as it becomes more comfortable. Again, this is better done with higher volumes, 10 to 12 reps, 2 to 3 sets. I can alternate between the lateral pelvic tilt and the rotational movement, just warming that hip up and preparing it for the next half. Okay, the third movement, and this is where we start to get a better idea of the muscle preparation, moving on from the joint preparation. And this is the seated push down. So I'm going to connect my whole leg and press through the foot, but I'm thinking about my hip leading the movement. And this way, my brain and my hip start to understand that they're the next thing that's going to be required. So I just push through one leg into the floor, get a nice activation through the whole leg, but specifically focusing around the hip, and I hold for 5 seconds. And then I move on to the other side, and and I press down through the whole foot, and I hold for 5 seconds. As I start to feel more confident, I can push harder, but not at the cost of what happens in the rest of the body. There is no value in pushing harder, but compromising your posture, the opposite leg, or the tension in the system. The fourth movement, and now we're starting to feel like we're ready to stand up. The joint is better prepared, the muscle and the brain have got a better idea of what's involved. So now I'm going to shift my body weight forward. I can take my feet wider to make me feel more secure, and I'm going to press through those feet and go forward and up. If I feel like I need to use my arms at first, that is fine. Either have them connected to your legs so you can get the sense of legs being involved. This is better than them being behind you because it changes the message and the brain gets confused. Am I going backwards or am I going forwards? And we want to go forwards and up. So feet press, body forward, up and tall. Okay, so let's recap. Just because you have hip osteoarthritis doesn't mean that the pain that you are getting from sit to stand is related to more damage. What we're going to do is prepare the joint first, so we give it some mobilization, some nutrition. Then we're going to prepare the muscles and the brain for what's going to be involved next. Wake up those sleeping muscles. Then we're going to move in a specific way, giving some regressions and support if we need it, but then progressions if we are ready to move on. And in this way, we can build confidence and comfort in the hip.